The Picornavirus family is a family of RNA viruses, and there are 5 important viruses that you're going to need to know for your Step 1 exam. Can you name those 5 viruses before I show them to you? Good, they're the poliovirus, the echovirus, the rhinovirus, the Coxsackie virus, and the hepatitis A virus. Hopefully the mnemonic device PERCH will help you remember these 5 viruses. It is important to remember that all the viruses in this family are enteroviruses, except for the rhinovirus. They are called enteroviruses because they infect the enteric or gastrointestinal tract. By infecting the GI tract, they often cause GI symptoms, and they're spread by the fecal-oral route. In addition, something that is common for polio, echo, and Coxsackie virus is that they can cause an aseptic meningitis. Now, do you remember what the term aseptic meningitis means? Speaking broadly, aseptic meningitis is a term to describe inflammation of the meninges of the brain that is not caused by a bacteria. It is called aseptic because if a spinal tap was done, the cerebrospinal fluid that is collected will not have purulent drainage like seen in a bacterial meningitis. So it's considered aseptic. The cerebrospinal fluid actually looks pretty normal in the case of this type of meningitis. An important thing to know about the Picornavirus family is how they produce their viral protein products. Remember, these are positive sense RNA viruses, which essentially is a messenger RNA transcript, and that RNA is readily translated into viral proteins within the cytoplasm of the infected cell. The key thing with the Picornavirus is that this mRNA transcript is converted into one long polypeptide chain that is then chopped up into the active viral proteins by a process called proteolysis. This is actually fairly unique to the Picornaviridae family. Now let's discuss the poliovirus. Thinking back to your studying, do you remember how the poliovirus is spread? Well, remember, we just said it a moment ago. Poliovirus is spread by the fecal-oral route, just like all of these picornaviruses, except for which one? The rhinovirus. Very good. The rhinovirus is the only picornavirus that's not spread by the fecal-oral route. In the majority of cases, the poliovirus infects the gastrointestinal tract and presents as what is called abortive poliomyelitis. It's called abortive poliomyelitis because it is a benign condition where the virus does not affect the central nervous system and only produces a mild febrile illness, so you get some fevers and diarrhea. However, in unlucky individuals, the virus can enter the central nervous system and cause the infamous paralytic poliomyelitis that we all associate with the poliovirus. Paralysis occurs because the virus preferentially infects and damages the anterior horn motor neurons located in the spinal cord. By looking at this cross-sectional image of the spinal cord, can you point to the anterior horn motor neurons? Very good. It's going to be this number 1 here, this gray matter, in the anterior portion of the spinal cord. Do you remember what important spinal cord tract is responsible for bringing the motor neurons, the upper motor neurons that synapse here? It is the lateral corticospinal tract. Very good. Early 20th century, poliovirus had caused major epidemics that were responsible for crippling thousands of people, mostly young children, during the summer months when the virus was most easily spread. This image here shows an iron lung, which is a negative pressure ventilator that helped children breathe when the virus infected the nerves of the diaphragm and were unable to initiate respiration on their own. Now, can you remember back to the nerve roots that innervate the diaphragm? The nerve roots that innervate the diaphragm that are affected by polio are C3, C4, and C5, which keep the diaphragm alive. And this turn into the phrenic nerve, which is the peripheral nerve that innervates the diaphragm. Very good. Thanks to the development of the polio vaccine in the 1950s, the number of polio cases per year decreased dramatically to the point where it is almost unheard of to see poliovirus or poliomyelitis in the United States today. There are 2 vaccines that you need to know about and are available to prevent polio. Do you remember what they are? Very good. This is the Salk and Sabin polio vaccines. Very good. Now, can you think about what kind of vaccines they are? So the Salk vaccine contains a killed virus. Remember, Salk with a K stands for killed. It is also called the inactivated poliovirus, or IPV. This is administered by an intramuscular shot. The Sabin vaccine, on the other hand, contains a live, attenuated form of the poliovirus and is also known as the oral polio vaccine, or OPV. Do you know which one is used in the United States? The Salk vaccine is used in the United States. However, the Sabin vaccine is the vaccine of choice in many other countries. Now, can you think about why it might be preferred in some other countries but not in ours? Well, for a number of reasons. The Sabin vaccine is easy to administer. It is an oral medication that is much more simple to administer than an intramuscular shot. Also, since it is a live attenuated virus, it actually induces a better immune response, including both humoral and cell-mediated responses. In addition, it leads to a mucosal IgA response in the enteric tract, which interrupts transmission of the virus through the fecal-oral route. So you really get a much better immune activation and immunoprotection with the Sabin vaccine. However, because the Sabin is a live attenuated vaccine, on very rare occasions, about 1 per 750,000, the virus can mutate and revert back to a wild-type poliovirus that has the ability to cause the sinister paralytic poliomyelitis. And that really is the reason why we don't use a Sabin vaccine in the US or in many other industrialized countries where the killed intramuscular vaccine is readily available. Next, let's talk about the Coxsackie virus, which is a virus that can present in humans in a number of different ways. There are 2 key forms of Coxsackie virus that can affect humans, Coxsackie A and Coxsackie B. Coxsackie A virus is responsible for causing herpangina, which is a painful blistering infection of the mouth that usually infects young children. It can also cause a hemorrhagic conjunctivitis, as well as a disease called the hand, foot, and mouth disease, as we can see here. Hand, foot, and mouth disease commonly affects young children and is characterized by fever, sore throat, loss of appetite, generalized malaise. And after the onset of this fever, we see painful vesicles that appear in the mouth and throat, the hands and the feet, hence the name hand, foot, and mouth disease. Coxsackie virus is one of the small number of viruses or pathogens in general that can cause lesions on the palms and soles of the feet. What are the 2 other important causes or pathogens that can cause lesions on the palms and soles? Can you remember? Syphilis, very good, and Rocky Mountain spotted fever. Very good. So the 3 pathogens or diseases that show up with lesions on the soles and palms and feet include syphilis, Rocky Mountain spotted fever, and the Coxsackie A virus. Very good. The Coxsackie B virus, on the other hand, is responsible for 3 important diseases, including encephalitis, cardiomyopathy, and aseptic meningitis. This is Coxsackie virus B. The cardiomyopathy caused by Coxsackie virus B actually is fairly significant. It can cause a dilated heart failure that is most pronounced and the most common cause of congestive heart failure in young people. So as you can see, the Coxsackie virus, both A and B, can manifest in a variety of different ways. I remember Coxsackie virus A as something that affects young children, where their hands are all over, touching their eyes, touching their mouth. They get lesions in their mouth, lesions in their eyes, lesions on their palms, and then soles of their feet. And then you have Coxsackie B, which causes a more severe disease, including encephalitis, cardiomyopathy, and then an aseptic meningitis.